Hi, Yara. Welcome back.
Hi. Thank you.
Hope you had a great Christmas and a wonderful start to the new year.
Thank you. I hope you did too. It was a
I
much needed break.
I had to work, but it was fine. We had a potluck at work, and it
You worked
was
on Christmas?
yes, I did.
Oh,
Got the colleagues off who had kids,
that's
so
sweet.
and working with all the nurses and the residents who were on call was a lot of fun.
That's
We
good.
had like a potluck, and we bought some food, and it was good. It was busy. We did
Yeah,
have a lot of patients, but it was good.
that's good. I remember when we used to do the potlucks when I
Oh
was there.
yeah. So how
Yeah.
was yours? You tell me about your
It was
December
so
and
nice.
January.
Yeah, it was so nice. We started break December 13th. So really the first couple weeks of December were just our final exams. And they were honestly some of like the easier material, which worked out pretty nice. We had a few lectures for a class called medical communication. So they just brought people in and just kind of exposed us to like interviewing patients and how to talk to patients, more kind of casual surface level stuff to just help us as we get into this semester. And then we had our only like massive exam in December, which basically I feel like it involved all of PA school in one exam,
Oh,
but it
wow.
was a lot of neuro stuff. So it was a lot of like the central nervous system, autonomic nervous system medications you want to give, more so like the pathophysiology of some of those like body systems versus like diseases and stuff. So we were just learning about different parts of the brain. When we're talking about emotion, when we're talking about vision, just like stuff that I found very interesting. I don't think a lot of people in my class did, but so that was really cool. They touched a little bit on endocrine, I think, just to introduce us. It's one of the heavier stuff. So just kind of a small introduction, which is nice. I'm noticing a difference this semester already.
Okay.
So those were kind of our two big ones. And then we had a very small exam that was barely, I think, 20 questions, which was great. We all wanted it. We took it in like 10 minutes.
You're
And
on
then
holiday mode already.
yeah,
Being
we
ready for
were. It was
Christmas.
our last exam too. It was, I think, designated to be 2 hours, and then the majority of the class left in 20 minutes.
Oh, wow.
I think we were all
No,
just.
before you go any further, you talk about they brought in people in and you talk about patients and were they real patients or were they like actors or models who pretended to be
So they
patients?
just brought speakers.
Okay.
As of now, it was just kind of speakers, doctors in the field, PAs in the field, just stuff to get us to think about um, when you approach a geriatric patient. Make sure to look at this stuff. This is how you talk to a patient that's maybe peds and showing up with family. Just kind of more of those big picture stuff so that when we get to those modules, at least we have that a little bit to reference when we're so heavy in like the diseases.
This is like how to do in history and physical. Is that what it
Yeah,
was? Like how
yeah.
to talk to a patient and
Yeah, we did that a lot with medical communications. Is like, okay, you have a patient that is complaining of a headache. If it's not necessary to like ask them about other body systems that aren't really pertinent to what you're doing, here's how you condense your interview. So it's
okay.
kind of like that core exam too. So they were teaching us how to do that too, instead of going through every like review of symptoms for every body symptoms. It gets to be a lot.
Oh, you'll
So
be there forever with each patient
yeah.
then. Yeah.
Yeah, I think the not the last meeting we had, but the one before, I talked about that IPA OSCE that we did, where I did a
Hmm.
full physical exam on a partner, and he did it on me, and that took an hour because you're
Yeah.
going through everything. So by the end of the semester, they were just teaching us that's not really necessary. That's not what you'll be doing in the real world. Here's how you kind of see what their symptoms are and what they're telling you, and cluster it in a way that makes sense.
So
So that was really
basically,
cool.
yeah, so basically you tailor your physical exam based on the chief complaint and
Yes.
maybe, but you cannot just say if it's headache, you can't just focus only on
No.
neuro, right?
No, exactly.
Just
Exactly.
like how, yeah, just
Yeah,
like how in orthopedics, we say if you're examining a joint, you examine one joint above and one joint below because it could be related.
exactly.
So, okay.
Yeah, and even if they're like coming with an ear complaint, you don't want to just assume, oh, they're of a certain age. Maybe it's like age related, like hearing loss. Like, no, maybe they actually have either buildup in their ear, or if it's something neuro, or like they're just helping us kind of think about those, which I think was probably hard last semester when we didn't have any modules. And so we were like, oh, how do we do any of this? And so now that we're in a couple of them, it's been nice to see what they meant with like kind of clustering some stuff. So we did those, and then I went on vacation December 13th, and I was not ready to come back. I was very checked out. I went to visit family in the Middle East. I went to Dubai for a little bit.
Oh,
So it was
wow.
like 80 degrees. I was having a great time. All my friends were freezing,
We
which
didn't have
was
a white Christmas. It was kind of chilly, but not really cold.
it didn't
So,
snow.
no, no, no.
It's my parents live in Maryland and it's been snowing a lot. And Atlanta has been 70 degrees the past 4 days. So that's been really nice. I've
Okay.
been outside the whole time.
I'm sorry, I keep interrupting you. Go ahead. Finish
Yeah,
your
no, you're good.
vacation story.
So I went to Dubai for kind of Dubai and Jordan. I was a lot of places for a few weeks and spent time with family. I got engaged,
Oh,
all big
wow.
yes.
Engaged in the middle of fiasco. That's
In the middle
awesome.
of, I know I didn't want it. No, just kidding. I'm kidding. No, it came as a great surprise. So I'm very grateful. But it
So
was a
you
lot
got
of
engaged in Dubai. You were in Dubai when this
I did,
happened.
yeah.
Okay. Did you
We
expect it?
no.
No. That's the
No,
best part.
I it was honestly, I think you think something is going to happen for a while, but then when you're actually in that moment, I have no idea what happened. I don't think I have any memory of that day. Like outside of the pictures and the video, I have to like remember that that was me in the pictures because I just completely blacked out. But yeah, we were on a boat and he proposed, which was really sweet. And then we went to dinner after. And I think the restaurant was confused. They thought he was actually proposing at the restaurant. So
Okay.
they made us a cake that said, "Will you marry me?" In case I said no the first time, I could say yes, maybe the second time. So it was really funny. But it was a
Awesome.
lot of fun.
What's his name and what does he do?
His name is Ibrahim. So he's a financial auditor, very different
Okay.
fields. So he's been primarily working in Dubai for the past 10 years, but he's actually already in DC now. So he kept the same job that he had primarily, basically, but just moved to the US. And his new job is actually like finances for healthcare companies
Oh,
and the
wow.
healthcare system. So he's been taking lessons recently about like what drugs do you need to see and what's the difference between like a general practitioner but an inpatient doctor, like things he's never seen before. So it's nice, our worlds are kind of colliding a little bit, which is really cool.
Well, all I can say is Ibrahim is a very lucky guy
I
and
thank you, I'm very lucky
and
too.
a smart guy to put a ring on
Yeah, he was like she looks stressed.
it.
He's like there's no better time.
That's a good reprieve. Well, you broke the cardinal rule that people say, PS school is very stressful and forget about your social life while in PS school.
I
But
know.
it looks like you can and do have a life while in PA school.
Yeah, you can still have fun. I think what I've realized is when it's very stressful, the hours honestly fly by. Like when I'm studying for an exam, 12 hours in a day go by of me studying and I don't even realize that 12 hours went by because you're just so locked in, but that gives you the freedom of doing other things and having fun. And they do it well in school. When you're on a break, you have no assignments. There's nothing to catch up on. You're starting something fresh when you come back. So truly, I took an iPad for fun and did not look at a thing. So that was all I did. But it was nice being in nice weather and kind of surrounded by people I love. And my family lives so far, as you know. So it was nice getting engaged and celebrating with them all. It was a shock for everybody. So it was really fun.
Did they
Yeah.
know?
Oh, everybody's known since like June, I think.
Okay. You were
He's
the
been
last one.
yeah, I was the last one to know. He's been planning it for a while.
Oh,
He did really good, so that's
that's
good.
wonderful. Congratulations.
Thank you. Thank
Okay.
you.
Now, was it hard to come back from that to real world?
Yeah. Yep. Yep. I came back. I started school January 6th and I came back to the US January 2nd, I think. I was very, very jet lagged. And then I had barely spent a day with my parents before I like came back here to just get my life together. And they just start you right away. There's no,
There was no warm-up period.
no, there's no warm up period. It's day one. And our first couple modules have been psychiatry, which we finished already, dermatology, which I finished last week, and then currently I'm in infectious disease. So they're very different. So it's been nice kind of assessing
Okay.
that.
So just to bring it back and have a continuity. So you had your mini test about interviewing patients and all this stuff, and you went off for a break after the exam. So that
Yeah.
semester ended. That module
Yeah.
ended, and then you went off on a vacation. You got engaged. You celebrated Christmas. You celebrated
Yes.
New Year's. Then you
Yes.
came back now in January. So now let's go.
Now we're starting something new. So the last semester in December was just those three exams that were for different classes. the foundations of medical science, the intro to patient assessments. Those were the exams I took that I know we mentioned before. Starting January, we're now in official didactic year. So basically what they'll do is they'll give you blocks of modules, and every 2 to 4 weeks is how long a module typically is. Psychiatry, for example, is a smaller module. So they started us off with ones that are typically lighter than, say, cardiology or pulmonology or even neuro. So we started off with psychiatry. We did that for a couple weeks. Emory does a really good job of bringing in like doctors or PAs from the real world. So just seeing what they do. So when we were in psychiatry, we had a doctor come in pretty frequently and talk a lot about bipolar disorder, about schizophrenia. So it's nice to hear his stories and see how he gave the medications that he gave versus just studying a table and not understanding it, because you're not actively prescribing it to anybody. So we do that for the set time that they designate for it. And while you're in psychiatry, you're not studying any other topic.
Okay.
They don't try to include other modules. What they'll do is, we're currently in an ethics and an epidemiology course that's kind of scattered throughout. It's not an every week type of thing. I think that's just to get us thinking about research and how we got to the point that we got to with medicine. And so it's really helpful. It's not super related to the module, so it doesn't stress you out too much, because you
Okay.
can just kind of put it to the side while you're focusing on your modules. So we do psychiatry, and when we did that, we took 3 exams.
Okay.
So you do your module exam, and that's basically just the diseases. Kind of psychiatry is a lot of that criteria versus like actual tests that you can do, just because it's difficult to diagnose with psychiatry. So we learned a lot about, if a patient has ADHD, for example, here's how much criteria they need to meet, and this is what it looks like. So that was kind of the module exam, is just understanding those concepts. And then we had the pharm exam right after. So that one is just heavy medicine. You have schizophrenia. What's your first line treatment? If you want to give like an antipsychotic, which one would you give? But you're worried that your patient might have these kinds of effects. So just to get us thinking about the medications. And then we did or to be fair, that was the first one we did was our OSCE, that simulated patient. That was interesting. That was a lot of fun, actually. That was our first ever like going into a room and assessing. It's an SP, so it's really not a real patient yet. They're kind of a simulated patient. So they're given
a live person.
Yes.
Okay.
Yes, a live person. So we walked in, and outside of the room, so they're in the room waiting for you, and outside the room you have 5 minutes to get their vitals, to read the chief complaint, to kind of jot down any big ticket items that you want to ask them. Given that this was a psychiatry one, a lot of the stuff that we wanted to ask were those psych related questions, maybe some neuro questions. If we were worried about things like depression, maybe eating and sleeping and kind of those behaviors, but things like cardiovascular probably weren't as important for us to be wasting time on. So that's part of what they were helping us narrow down. And then you go into the room and you have 20 minutes to interview the patient. And then in your last 5 minutes, you have to give them the diagnosis that you think they have. So that can be a little bit nervous, especially if you get it wrong, but they don't care if you get it wrong. It's truly like such a small percentage of your grade. They just want you practicing. So you tell the patient what you think they have and what your next steps are going to be. And then you leave the room and they give you 35 minutes to write a note. And so basically the minute that the note opens, you have to write everything from like the history, the patient's history, the family history, the chief complaint, kind of all the stuff that you talked about. And then you have to come up with a differential diagnosis. So you have to come up with 3 things that you think might be going on. The first one being what you really wholeheartedly believe is happening. And then the other 2 are like, okay, it could be this too, because this patient told me these things, and that could also align with this type of disorder. And then just if you recommend medication, here's what you'd give. A lot of psych is more of those cognitive behavioral therapy and family-based therapy stuff. So you kind of jump in and you recommend those if needed. So that was fun. We all get the same patient, different people, but the same disorder. And this year they gave us PTSD. So that was,
okay.
So that was interesting, because initially when you go into the room and they're presenting a certain way, you immediately think, oh, like this maybe looks like depression. They're meeting some of this criteria, but then they start telling you more and more things like, oh, somebody came into my house 6 months ago, and you're like, okay, 6 months ago is the timeline for you're like working through it as you're in the room. So that was really nice, just getting to work through that. But yeah, that's what we did.
Okay. So just to recap, when you said PTSD, for people who don't know, it's post-traumatic stress disorder. And
Yes.
to recap, what you just said so far was you interview patients and you do a focus examination after hearing the chief complaint,
Hmm.
and you come up with three differential diagnoses. I'm glad you said that because I also harp with all my students that I teach that don't try to nail a diagnosis because then you're going to miss a lot of stuff.
Yeah,
Maybe not in psychiatry, but when you're talking about other systems, a lung problem can actually be a heart problem,
yep.
So, and vice versa. So when you talk about a chest complaint, you also want to include about lungs, you want to include the heart. So it's good to come up with three differential diagnoses, not just for psych, but for any chief complaint that you come
Yeah.
across. And that's a good exercise to have because you'll notice that it's easy to come up with the first one because you think this is what it is. It's kind of a little hard to come up with the second one, but the third one is
Oh
already
yeah.
very challenging.
Oh yeah. I think I said PTSD, and then I think I said like generalized anxiety disorder. And the last one I said I think was nightmare disorder. I was like, okay. I mean, it kind of fit, but
Yeah.
it's definitely not what she had. But it was kind of funny, and a lot of people did that, so it was funny to see like our thought process was pretty similar.
And
But
you
that was really
mentioned farm. Farm is pharmacology, so you talk about medications as well.
We did.
Yeah.
Our professor that teaches a lot of our farm modules is also our dermatology. She works primarily in dermatology. So we did psychiatry and then we moved on to dermatology. So we got kind of that linear aspect of her teaching style, which was really great. But they try to separate them. So even when we're learning certain diseases, we did dermatology for a while, and when we did that, they would tell you about different manifestations of like disorders, whether it's vascular, whether it's autoimmune, just kind of different things the patient's going to present with. And they do make recommendations for medications you can give. So that was nice. You could at least kind of start seeing the medications early on, even if you weren't taught the pharmacology until a little bit later. So derm just doesn't have an OSCE because you can't really kind of make up something on the patient. So we didn't do that for that one, but we got to do a skills lab, which was really cool. That was fun. That was our first ever skills lab. They take you down to a room and you get to practice different skills that relate to what you're doing. So we got to do ultrasound, which was really
Oh,
cool.
okay.
That was really fun. I had my friend's ultrasound near my neck because I have a firm belief I have a little bump right here, so I have nothing. So that was a little bit boring to see. And then we got to do like a shave biopsy.
Okay.
We got to do just injections. Those are gonna be applicable to
You
every
you
module
practice
coming.
injections on each other?
No, no, not
No.
yet.
Okay.
Not yet, but I know one day we're all gonna sit each other down and we're gonna say,
Well,
okay.
in my school, we practice drawing blood on each other.
We honestly should. We're doing heme onc
Yeah.
next. We
Oh,
should
wow.
just start drawing blood soon.
Okay. So
Yeah,
here's the question: when you did psychiatry, did you guys self-diagnose yourself? What kind of personality
every
you had, or
disease.
personality disorder you had?
Yeah, every disease. I think I have a mix of all the personality disorders. Every time they talked about bipolar, I got like way too excited. I was like, this sounds exciting. My friend really gravitated towards schizophrenia. Like it was just our whole class was just self-diagnosing at that point. It was really
Yeah.
funny.
So psychiatry, you did dermatology. Anything else in January?
We're doing infectious disease right now.
Ah, one of my
Yeah.
favorite subjects. Yeah.
I actually really love it.
Yeah.
I'm having a great time.
Because
I
no matter
think
what specialty you go into, it
yeah, you
affects.
need it.
Yeah, and you need to know the antibiotics.
Yeah,
Yeah.
and that's what we started off like we haven't started doing much. We started on Thursday class, so we did the antimicrobials and then we did just an intro to like a gram positive bacteria, gram just kind of getting us to
Yeah.
see like, oh, if I'm telling you this antibiotic, this is why. I honestly didn't really love derm, so this is a great transition for me.
Yeah. I'm averse to all the rashes and pustules and papules and stuff like that.
No, and
Yeah.
my friends who I have a lot of friends that work in derm. So when I was getting frustrated with derm, I was like, everything looks the same. And they're like, no, you have to read the description. And I was like, but all the descriptions are the same. Like they all look the same. I don't know. But
Yeah.
so I really like the idea of derm. I think I just personally see myself more in an inpatient setting. So getting to do the modules that I think align most with what I'm interested in. And ID has been I mean, I've always loved psych, and for some reason, I think I like ID more. So it's nice to kind of figure out what you like and don't like as you go.
That's good. So
Yeah.
these are the three things you're dealing with in January.
Yes.
And you'll have an exam in all three of them.
Yeah, I finished exams for psychiatry, for dermatology. I have an ethics exam on Tuesday, an ID exam on Monday. I just it just
What
continues
do they
on.
talk about? What do you teach in ethics class?
So ethics has been really, I actually messed up. I have an epidemiology exam on Tuesday, but we still take ethics. Ethics we take once a week. The last topic that we discussed was poverty and health, and they
Mhm.
made us do exercises where we they basically divided into stations, and they basically gave a group of people either health insurance or not, and then they taught you to really evaluate what patients without health insurance have to go through on a day-to-day basis, one, to get health care, and two, just the finances behind it. Is like every hospital visit is costing you this much, but if you don't have a health insurance, you're probably going to avoid going to the hospital. And so those classes I really enjoy because they hit home for me. And then I always loved volunteering and kind of being at free clinics and doing some of that stuff. So I really enjoy the ethics part of those classes. So those have been really good.
Yeah, people always worry about when they don't have insurance, they only worry about like the doctor's visit, but getting to the hospital or to the clinic
Yeah.
and getting back, medications, and
Yeah,
then
just the
follow up. Yeah,
accessibility.
it's all they all add up.
Yeah, and a big thing that we talked about too is just when you go into a patient's room, you're automatically thinking of all the typical recommendations you would make. But if none of them apply, I mean, you're not really helping them. And if some patients are more hesitant to speak up about the lack of resources that they have, and you're coming in and telling them, oh, do this, this, and this, and they don't have access to any of those three things, then they're going to probably be more hesitant to open up about that. Then they'll leave, and it just becomes a cycle of where they're just putting themselves at more harm because of our lack of kind of competency in caring for them. So I feel like it's good to kind of work on those things early on.
Yeah.
So yeah.
What else did they talk about in ethics class other than poverty and
So
healthcare?
we did poverty and health. We did though another topic I really liked is really vastly different than this, but it was kind of just going into patients' rooms where a patient might be inappropriate or express things like maybe be a little bit more verbally loud, more expressive in what they say, to the point of whether it's targeting a female or male provider, whether it's targeting the provider's background, if they are not American, if they're not white, those kinds of topics that come up. And so the ethics professor was really trying to help us think about how we would respond if we were subject to that, but also how we would respond if I walk into a room and my friend was also in the room with me and I'm hearing them be on the receiving end of that. So it's good practice skills to just think about those because those happen more than we maybe realize or tend to admit.
Mm-hmm.
And I think a lot of us working in healthcare probably brush those off. And I've witnessed it for myself and a lot of the nurses that I work with. They're very strong and tough, but they probably have to deal with a lot of
Mm-hmm.
um, kind of those verbal remarks that just are uncomfortable for anybody to deal with. So it's good to kind of have us thinking about those. And some people are going to be really strong and deal with those better than others. And I think regardless of how you deal with it, it probably affects you in one way or another, even if you project that or don't.
Yeah, I'm
Yeah.
glad they're addressing all this in school and not letting you learn on the job
Mhm.
or having exposed the first time when you
Yeah.
encounter a patient. So it can be very hard to like accommodate or adjust.
Yeah. And some people, I think what I've realized when we did that lecture is when she was asking how we would respond, some people just raise their hand and say, oh, like I would just brush it off. But that's not really the reality of the situation. I think that's a small percentage of people
Hmm.
that have the strength to brush it off. And I talked about this in class too, but I think if you've been subject to that kind of discrimination your whole life and you've made to feel less than just because you were born a certain place or speak a certain language or look a certain way, um, it kind of gets exhausting to try to brush it off every time. And so I'm sure there's situations where people have brushed it off enough times to where they snap or they get upset,
Hmm.
rightfully so. But then it's on the other end that you do have a patient. So there's also that component of like, I do have to give competent care, but I also want to receive that respect in return too. So it was good to have those conversations.
Yeah. Um, Being a physical therapist from India, I when I first came to America and was starting seeing patients as a physical therapist, I did have my fair share of this.
Yeah.
You don't speak the way I do. I don't want you as my therapist. But
Yeah.
eventually, you kind of work it and try to win the patient over.
Yes.
Patience is a key one,
Yeah.
but it comes to a point where some things are not, it's not acceptable, and
Yeah.
you have to bring the concerns to the appropriate people and make sure that it doesn't
Absolutely.
happen or escalate.
Yeah,
Yeah.
absolutely. I think when you go through enough situations, sometimes you go through too many in one day. You can't just pick every single situation because you're unable to get by through the job. But when it gets to a point where it's really invading on somebody's personal space or privacy, then that's of more value than kind of interfering with the care that you're trying to give, but also your own like self-worth and self-respect. But
Yeah, because brushing them off, it probably can work temporarily, but it can lead to
yeah,
burnout. It can lead to lack of empathy. I don't know. You
yes,
become this clinician or robotic clinician where you
yeah,
don't take people's feelings into consideration because you're saying my feelings are hurt. I don't care about the rest of them. So you don't want a
exactly.
provider like that. So I'm
Yeah, you
glad this
want
is all
more.
being addressed, in a special class, and um, awesome, good.
Yeah,
And I'm glad that you're having clinicians come and talk to you, and not just lecturers who just,
no, yeah, the dermatology module was the heaviest module with people coming in from the field, and it is so nice to see because the way they're just so well spoken about the things that they do, but sometimes you get overwhelmed because they just know too much, but they know too much because they've been in it for so long. But
Yeah, it's not just book knowledge they're sharing. They're sharing like
yeah,
real life
it's real
scenarios.
life. And
Yeah.
so then I found myself asking them a lot of questions of like, oh, like I think I remember learning the first line is this medication. She's like, not necessarily though. So you start learning that like a medication might be the first line treatment, like the first thing that you give, but that's probably not the case for every patient. So that's been nice to break away from because even with just learning the antibiotics now, there's just so many that
Yeah.
do very similar things. And so you just have to kind of gauge the patient that you have and what kind of side effects they might get.
And you have to also worry about interaction between different medications what the patient is
Yes.
already taking. So
Yes.
yes, yeah,
Yeah.
awesome.
Yeah, that's been kind of ID I really enjoy. I don't want it to end, so we will see.
So keep
Yeah,
recapping again. So January was dermatology. You had infectious disease. You had ethics.
exactly.
You had epidemiology. You just mentioned about epidemiology. What do they actually teach you in epidemiology?
Our midterm is on Tuesday, actually. So according to what I studied, we've been doing a lot of, it's been very intro stuff of like, what is a case control study? What is an observational study, a cohort, retrospective, prospective, or it's just kind of specific studies that basically the professor just wants us to be able to pick up from a vignette or like a case. Okay, if they're trying to do this study, what type of study is most appropriate? Like if you have specific patients that you're looking back in time and to see if they've been exposed to this type of environmental hazard or not and where they are 25 years later. She's just trying to get us to understand what that looks like. It's a really cool class. I just don't have the research brain. I worry, but I'm trying my best.
No, it's good to know about epidemiology for each entity of disease as well, because it
Yeah,
tells you what's prevalent in a particular population and
yeah,
how the disease are spread.
exactly.
So good. It's a
It's
very rounded
yeah.
approach.
Yeah, it's been nice. The intro stuff has been nice. We still have a ways to go with epidemiology. So I think what you said with like the disease states and the how prevalent they are in certain populations is probably going to come up more. But our professor for that is great. She's has her PhD in epidemiology. She's has a lot of association with the CDC, so she's very honest and outspoken about kind of current politics and how that's affecting the CDC. But she's still coming in and teaching us all the great things about it. So it's been really nice to have a professor like that.
That's awesome. So what
Yeah.
is in store for February? What do you start after this?
So we do hematology oncology.
Oh, heavy.
Maybe I'm gonna look at my calendar every day.
Okay.
I look at my calendar every day because I don't know what's going on. Hematology, oncology, and then I think EENT, eyes, ears, nose, throat.
Okay.
EENT, EENT. We gotta
EENT,
look it up.
or at least in some hospitals, HENT. It's head,
HENT.
yeah,
Okay, yeah.
head,
So we
eyes,
do
ears, nose, throat.
head, eyes. That's
Ears,
probably
nose, and
it,
throat.
it's that's
Yeah.
exactly that.
Okay.
HE. That's what we're doing. So that we don't start until March. So February is
Okay.
just going to be infectious disease and hematology,
Yeah.
oncology.
Hematology oncology can be a little heavy, can be a little depressing as well. Just
That's
warn
what we've
you,
been told.
because you'll be
Yeah.
dealing with like cancers and stuff like
Yeah.
that. HENT is a fun topic. Yeah, there's a lot of cool stuff that to
Yeah.
learn and see. But hematology
Yeah.
oncology will be heavy, so be prepared.
Yeah, that's what we've been told too is we have a professor that's coming in to teach it and he's been a part of Emory for years and he helped do more research with sickle cell and he did it a lot at Grady, the emergency hospital situation in downtown Atlanta. So he's going to be teaching us the majority of that and he's just the cutest grandpa in the world. I think he's just like the best person ever. So I'm hoping
Awesome.
he can bring some joy to a lot of these lessons. So
Okay.
yeah.
Well, that's good. Well, I'm
Yeah.
glad I caught up with you.
Yeah, me
I'm
too.
glad you had a great Christmas break. It's good to have a break in between when everything is so stressful and
Yeah.
studying. And I'm glad a lot of fun things happen in your life.
Yes, so many,
Uh,
so many.
yeah. I can't wait to see pictures
Yes,
and
I
share it
will
with
send you
viewers.
some.
Okay.
Yeah.
Well, good luck to you. Are you going to watch
Thank
the Super
you.
Bowl?
Yes, unfortunately. I think I just for seeing my friends, I think I'm gonna have to be strong and go watch the game. So
Okay.
that is far from what I like to do, but I'm gonna try
Okay.
to be brave.
Good luck with all the examination in
Thank
your
you.
current module, and then we'll look forward to meeting you in February.
Yeah, that sounds good.
Okay.
We'll talk soon.
Okay. Take care, Yara.
Bye.
Bye bye.